This is Dr. Kamran. I'm a European Board Certified Plastic Surgeon, and today we are going to talk about Brazilian butt lift. So what is Brazilian butt lift? So the name Brazilian means that people who live in Brazil, they have very fit bodies, very high muscle mass, and thus they have a nice buttock projection. So regarding the procedure that enhances the projection of the buttocks called Brazilian butt lift. Okay, so but specifically when we tell someone that Brazilian butt lift, we mean enhancement of the buttocks with fat injections, not the implants. This is the first thing. And the next question is, how do we do it? We make liposuction basically, and which areas, of course, if you are a candidate for liposuction, we can remove technically from anywhere in the body, and as long as we need to give a new shape to the body, and all of the fat that is removed can be injected in the buttocks, but we have limitations, of course, how much we can inject. For example, it works in this way. We suction for about 3000 cc, 3 liters of fat from the body. This is the median amount of fat we generally suction from a normal patient who is like 70 kilograms weight. And how much fat we can obtain from this 3000 cc? It is approximately 1/3 of the aspirate, which is about 1000 cc out of 3000 cc we can have as an injectable fat. So we inject it as 500 cc and 500 cc. So this is the maximum amount of fat that we can obtain from 3 liters of fat. And what happens to this fat when we inject it to our body? So there are some gossips like all of the fat disappears and it's not permanent, and you do it and it just goes away. Actually, the answer is no, it's not going away. But what is the problem with this fat? Not all of the fat that we inject in the buttocks survives. Only half of it, like 40% to 50% of this fat can survive. And this is because of anatomy of our body, and not all of the fat cells can reach the blood circulation inside our body, and our body eliminates those which couldn't reach that blood circulation. So yes, it's permanent, but only half of it, approximately half of it, survives. So even if we overdo the injection and make a nice enhancement and nice projection to the buttocks, we always explain the patient that half of this fat will melt down, will disappear, and then after that, after at least 6 months to 1 year, we can see the final result. And then we see if the result is satisfactory, there is nothing more to do. We are happy, patient is happy, we are satisfied and fulfilled. But if there is not enough projection, we can redo this projection again. We can do this procedure again. We can do another liposuction if possible. If there is more fat in the body to be removed, of course, not giving damage to the other areas in the body, and all of the fat again in the same way can be filtered. And let's say we did another procedure and we obtained for about 1000 cc of fat, only 1/3 we can inject. So it's like about 300 cc, and we can inject it like 150 cc to one side and 150 cc to other side in the second operation. But of course, it depends on the amount of fat which is present in the body, and that fat should be able to be removed without any damage left behind. So yeah, we can remove practically from anybody in the body, from anywhere in the body, but we should not leave any damage behind. Okay, so most of the time we debate with the patients, so patients always want to get slimmer. But liposuction, unfortunately, is not a procedure that will make patients slimmer. We just give a better, nicer shape with liposuction. It's not weight loss procedure. It's a body shaping procedure. We have to understand this. So eventually, yes, the fat injection to the buttocks and Brazilian butt lift can be repeated for a better outcome. Another thing regarding this procedure, what if we don't have enough fat in our body? We are super skinny, we are athletic, but we are doing squats and we don't have enough enhancement of the buttocks, enough projection of the buttocks. What should we do then? Then, with reservations, of course, we can propose to put buttock implants. Implants, of course, they are foreign bodies. We just don't, promote putting some kind of foreign body into your foreign material into your body without any, cause for this. It's just, if the patient wants a better enhancement and we don't have any other options like our original fat, we just, there is no other option other than that, other than the buttock implant. So, buttock implants, how we perform them. Formerly, it was thought that we just open a pocket under the skin over the muscle and put the implant in, and then it will stay there forever. But we saw that whenever we do this, the implants expanded the pocket and started to turn under the skin because the buttock area is very mobile area, so it wouldn't work. And then we found out that placing the implant inside the buttock muscle, not under, but inside the buttock muscle, would work. And as we open a pocket inside the muscle and close it afterwards, the implant itself is entrapped inside the muscle, and there is no much space to move. Okay, and it acts actually as a muscle volume, enhanced muscle volume in our buttocks. So we can debate on whether it's foreign material, yes, and there are many risks regarding the buttock implants, yes, sure. That's why we have to choose the right patient for the buttock implants, and whether the patient is a better candidate for Brazilian butt lift, yes, of course we propose that to the patient. But if the patient's expectations are beyond the beyond what could be done with fat injections, then we can only propose the buttock implants. Of course, we tell the pros and cons, negative ways, disadvantage, advantage of both procedures, and then we decide which is the best for the patient. Okay, so this is technically all of the most important parts regarding the procedure. The rest is healing period. Of course, Brazilian butt lift patients get back to the work much earlier than the buttock implants because there is not much muscle pain like in buttock implants. But technically, in both procedures, we want our patients to lie face down for 2-3 weeks. Sometimes, yes, you can change position to your side, but it's the best not to sit on your buttocks or lie on your buttocks or sleep on your buttocks for 3 weeks at least. Longer is better for sure, but this will, constrict your daily life too much. So that's why our limitation is at least 3 weeks for this. And of course, you are wearing compression garments, and you wear them for 6 to 8 weeks in both cases. And after 2 months, you can start to enjoy the real look and the real outcome of the surgery, and without any problem, without any corset, without any restrictions. You just, most of our patients look at themselves in the mirror after the shower, let's say, and they spend more time in bathroom than before.